evening. Thank you all. So let's do that. It works. Thank you all so much for joining us this evening. My name is Leah Halley. I am the Director of Operations here at Doctors for Change. And I've been with the organization about 2.5 years now. It's been incredible to see kind of the growth over those past couple of years. This evening we are focusing on integrated models of healthcare, and I'm very excited about the speakers that we have as well as the panelists that we have. But first I wanted to just give you an overview of who we are if you are unfamiliar with us. There are some general brochures on your table that kind of provide additional information if you would like it. But just generally, we are a nonprofit organization, 501c3, located here in Houston, and we focus a lot on advocacy. And so then people are like, oh, okay, well, you're political. No, we are nonpartisan, and we focus on trying to find those kind of, solutions that are middle of the road, help out both sides of the line that they can agree on. But our network in Houston is over 900 both healthcare professionals and non-health professionals. So you can see here, if I hadn't had this little thing come up, I'll turn it over, that we have physicians in our group, we have nurses, we have social workers, but we also have lawyers, and we have other just professionals that really care about the health of our community. So what is our mission? Our mission is to increase access to care and improve the health of all Houstonians and Texans through research, education, collaboration, and advocacy. So it does pull in that piece, and though we are a Houston-based organization, we work to address policies that ultimately impact all of our state. In order to accomplish that, our vision really, that keeps us going day in and day out, is that Houston and Texas will become healthier by ensuring that all persons have access to high-quality, comprehensive care, regardless really of any of those socioeconomic factors that so often get in the way of them. We have now 5 committees, I'm proud to say. For a while we had 4 focus areas, the first 4 that you see up here: access to care, mental and behavioral health, healthy eating, active living, anti-human trafficking, and now most recently, immigrant and refugee health. If you are interested in that, I'm just going to put in a quick plug. We have our first Immigrant and Refugee Health Committee meeting on Monday evening, and it's going to have a lot of discussion really about, where do we want to focus on, what partners can we collaborate with in the Houston area that are already doing great work. What can we as healthcare professionals, providers, add to that discussion? So it should be a really great evening. In addition to these different focus areas, we also now have 3 student chapters at medical schools in the Houston area. So Baylor College of Medicine and UT McGovern Medical School have been our longest running chapters. We also just started a chapter at UTMB in Galveston, which we're very excited about. So what do we really do? This just kind of gives an overview of kind of how we approach some of the issues that we do. Focusing on local issues, both local Houston and local statewide, and achievable goals. So really, though we have, high dreams, we try to pick those tangible things, those incremental changes that will really make an impact to the system. We educate the community and healthcare providers about ways that they can actually make a difference just day in and day out, advocating both locally and at the state level. And collaboration, I would say that this is one of our strongest factors, is being able to work with many different groups throughout the Houston area in each of our issue areas. We know that as one organization we cannot accomplish as much as we can by working with others that are focused on the same goals. So with that, a quick introduction, I would like to call up now one of our Access to Care Committee co-leaders, Fatima Saeed, to give you a brief overview of the Access to Care Committee itself and introduce our speakers for the evening.
Thank you, Leah. So I'm delighted to introduce you all to the Access to Care Committee on behalf of our leadership team, which includes myself, Suja Agarwal, and Melinda Sohan. So this committee was really established to address this unacceptable reality that in our city, a city that boasts one of the largest medical centers in the world, many Houstonians can't access even basic health care. And usually this is as a consequence of their insurance status and a lot of other complex issues. And as providers who are committed to delivering the best possible, most holistic care to our patients, it's no longer feasible for us to ignore the factors outside the exam room that often have a greater impact on the outcomes of our patients than our individual interventions can. So even a cursory look at our complex healthcare system reveals that providing adequate care involves addressing many non-medical needs, including transportation, language barriers, food insecurities, the list goes on. So this reality kind of underscores the importance of helping patients to navigate this complex healthcare system, to get them from one provider to another without falling through the cracks. So as you might guess, this isn't really possible without an infrastructure that facilitates this on part of providers. And so it's on that note that we would like to introduce you to the theme of tonight's forum, the Integrated Healthcare Team, providing coordination of care to improve patient outcomes. Tonight, you will hear from a variety of outstanding providers, each of whom works within a setting that utilizes effective coordination of care for the betterment of their patients. From their experiences, we hope to develop a comprehensive understanding of the challenges of establishing coordination, the benefits it can hold for the people we serve, and perhaps most importantly, how we can adapt their lessons to enhance the coordination of care in our own respective healthcare settings.